tonight.
I didn't have the strength. I couldn't walk as much as I used to.
I noticed that it wasn't taking as much effort for her to get winded.
An abc27 special presentation.
Consensus was to treat her valve, repair her mitral valve using MitraClip system.
Heart to Heart, sponsored by Penn State Health Milton S. Hershey Medical Center.
Good evening, I'm Deborah Pinkerton. Welcome to our 10th anniversary special for American Heart Month. Heart problems can affect us all, from birth defects to heart disease. Currently in the United States, there are approximately 1.4 million adults living with congenital heart defects. As for heart disease, according to the American Heart Association, cardiovascular disease accounts for more than 800,000 deaths each year. How are heart defects and heart disease treated? You'll find out tonight. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Christina.
Hi, Deborah. Specialists from Penn State Health Milton S. Hershey Medical Center are in the abc27 call center to answer your questions until 8 o'clock. You can call the number on the bottom of the screen, or you can email your question during the show to questions@abc27.com. Dr. Tariq Ahmad will answer your emails throughout tonight's show. All calls and emails are confidential. And I'll be back later in the show to share some of those questions with you. Deborah.
Thanks, Christina. There are major strides being made in the medical technology used to fix the range of heart conditions. Erica Moffett-Dilk spoke to one woman who underwent one of the latest heart procedures available. Here's Verna Rose's journey.
After 60 years at the Milton Hershey School, Verna Rose retired. But retirement didn't mean slowing down.
Now I do a lot of volunteer work at my church. I play bridge. I try to exercise every day.
At almost 84 years old, Verna makes exercise a top priority, heading to her basement to use her treadmill or bike every morning.
It makes me feel good and I keep my weight off. It's just something that I always do first thing in the morning when I get up. It does make you feel good, and I know it's good for your health.
But a few years ago, things started to change.
I didn't have the strength, and I couldn't walk as much as I used to, and I just didn't feel right all over.
Verna's husband, Chester, also noticed something was different.
Well, she was tearing easier. I noticed that it wasn't taking as much effort for her to get winded.
So Verna went to the doctor and asked that they run some tests on her heart. The results? A leaking mitral valve. Certified registered nurse practitioner Denise Rhodes explains.
When we think about those valves, we often think about it as a door, and the door is completely closing and the door is completely opening. And as that calcium builds up, the doors are not coming together completely.
Age, along with some other factors, made Verna too high risk to be a candidate for open heart surgery. Interventional cardiologist Pradeep Yadav recommended something else.
The consensus was to treat her valve, repair her mitral valve using MitraClip system. So through the patient's groin, we advanced this catheter all the way to the heart, and once we are close to the mitral valve, we use these variety of knobs that are outside the patient's body to open this clip and close this clip.
Verna's husband recalls being worried about what his wife was going to undergo.
I was concerned of what they were going to do, how they were going to do it.
Verna received the mitral valve clip and all went well.
The procedure was very successful. We were able to clip this mitral valve and reduce that leak dramatically, and we saw that instantly.
After a 24-hour stay in the hospital, Verna was cleared to go home. And amazingly, just days later, she was settling back into her normal routine.
He said having this done would give all my energy back, and it has. I have more energy than I had in a couple years.
The first week after her procedure, I had to keep reminding her, now, slow down. You just had a procedure. She said, but I'm feeling okay. I'm feeling okay.
Verna says she is thankful for this type of procedure since she could not have her valve replaced. There have not been any side effects and she feels great. Joining us now is cardiologist Dr. Anisa Chaudhry. Thank you for being with us.
Thank you for having me.
Verna, now she had this problem. It developed later in her life, but for some adults, they actually date back to their birth.
Yes, absolutely. So congenital heart disease, by definition, is heart disease that's been present since birth. The vast majority of patients were treated since childhood, but there's a small minority that do present as adults. And congenital heart disease can really affect any portion of the heart, including the heart chambers, the heart valves, the vessels that drain into the heart and the drain away from the heart, as well as the electric conduction system.
And what are the most common types of congenital heart disease?
Yes. So when we think about congenital heart defects, we divide these into two groups. Those who are born blue or with cyanotic heart disease, and those who are born pink or normal color with non-cyanotic heart disease. The most common of the cyanotic defects is tetralogy of Fallot, which has two things. It has a hole in the bottom chambers of the heart called a ventricular septal defect, and a narrowing of the valve that connects the heart to the pulmonary artery called pulmonic stenosis. The two most common forms of non-cyanotic heart defects are called bicuspid valves and septal defects.
And what are some of the symptoms you should look for, especially if this is something that you're not born with?
Yes. So the symptoms of the heart defect really depend on what kind of congenital heart defect you have. So patients, for example, who've had tetralogy of Fallot, if they've already been surgically repaired, they may have progressive pulmonary valve leaks, and this can present with heart failure symptoms, leg swelling, abdominal discomfort, unexpected weight gain, shortness of breath, heart rhythm abnormalities, and sometimes those who've actually never had repair of tetralogy of Fallot can actually present blue with poor oxygenation levels and very poor exercise capacity.
Are there no risk factors?
Yeah, good question. So for the vast majority of congenital heart defects, there's actually no known risk factors. That being said, there is thought to be some genetic correlation. So we know that amongst parents who have congenital heart disease, they have an increased risk of their kids having congenital heart defects. The average population has about a 1% risk, but kids of patients who had congenital heart defects have about a 5% risk. There are genetic syndromes such as Down syndrome, Turner syndrome, and DeGeorge's that all have higher risk for congenital heart defects.
And how are these patients treated? I mean, this is something, I guess, individually and for life.
Yes. So most patients with congenital heart disease probably would have had surgery at some point. These are usually the complex heart defects, but some of the milder ones never need surgery. Most of them all need lifelong follow-up with a congenital heart specialist, and sometimes we can use medications to treat things like heart failure, rhythm abnormalities that are associated with congenital heart disease.
Okay, a lot of really good information tonight, Dr. Chaudhry. Thank you for being with us.
Thank you again.
And let's check in with Christina Butler in the ABC27 call center. It sounds busy over there, Christina.
Hi again, Deborah. It is busy over here, and you can call in your questions. Just dial 717-346-3333. And here to answer our viewer questions tonight, Dr. Stephen Ettinger, an interventional cardiologist. So we want to get right to our first viewer question. Here it is. She writes, my husband is 59 years old, doesn't exercise, and is overweight. He's been on statins and blood pressure medications for years. He gets stress tests with good results. Is he a high risk for a heart attack, and is there further testing he should get?
Sure. Well, I think there's certainly reason for concern, but it seems like the wife as well as her husband are focused on this issue. So when we think about patients with heart disease, we look at high blood pressure and diabetes, their cholesterol profile, and do they smoke. Sounds like he does have some of these risk factors that we associate with patients with heart disease. Sounds like he's also getting regular checkups and stress testing, and so sounds like he's being monitored. So I think overall that there is a risk, but these risk factors are modifiable, and that's the good news for this patient.
Okay, thank you very much. And again, if you have a question for a specialist, you can call or you can send it in through email at questions@abc27.com. And coming up on Friday, March 9th at 12:30, join us for a special Good Day PA. We'll share two pediatric heart stories. One child was diagnosed when her mother was only 18 weeks pregnant. Stay with us. We'll be right back.
You're watching Heart to Heart on ABC27, sponsored by Penn State Health Milton S. Hershey Medical Center.
Welcome back. Heart disease can happen at any age. For some, it's hard to recognize the symptoms or they are ignored. Joyce Wirt shares her very personal story. Joyce Wirt plays the song day by day to help her get through some of the most difficult times.
It's a song that talks about our life as we go through struggles, as we have trials, as we have difficulties. We're not quite sure what each day is going to hold for us.
Joyce's biggest struggle came the evening of January 27th, 3 years ago.
I was sitting on my living room couch watching the news, and my doorbell rang. Not expecting any company, I went to the door and opened it to find 2 state police troopers. The one gentleman trooper said, "We have some really sad news to share. Kevin passed away." I said, "You must have the wrong person. It can't be Kevin." Kevin goes to the gym and he exercises, he eats right.
Joyce was told her son was at the gym working out when someone called an ambulance.
He got off the treadmill and was walking over to an exercise bike, which was the second part of his exercise routine. He bent down, and the other people in the fitness center thought he was tying his shoes. He remained in that position and he didn't stand up. They laid him on the floor, began CPR, and of course called for the ambulance right away. And they continued to work on him, tried to revive him, and there was just no life.
Doctors say Kevin died from severe coronary disease. Just weeks before Kevin passed away, Joyce says her 46-year-old son was diagnosed with high blood pressure and he was taking medication to treat it. He was scheduled to meet with a cardiologist.
He was a driven engineer, and so he had a project that was due the same time his appointment with the cardiologist was due. So he put his health aside and wanted to complete his project. They rescheduled him for later with the cardiologist, which he never got to keep that appointment.
As any mother would be, Joyce is heartbroken. She remembers all of the wonderful times she had with her son, including their last Christmas together, and only wishes there would be more.
It was such a tragedy, such a loss for a wonderful son like Kevin was and always will be in my heart. I miss him so much.
Joyce hopes others will learn from this tragedy so another parent doesn't have to experience this pain.
Each day, the pain never goes away, but you learn to face it. You learn to adjust and to find ways of comfort. It has been a struggle, but I also know that with the faith that I have in God, He helps me through each day. So it's day by day.
Joyce stresses the importance of knowing your risk factors and doing something about it if you have symptoms. Don't ignore them. See your doctor. And we're going to check in with the doctor right now, Dr. Michael Farbaniec, a cardiologist at the Med Center. Thanks for being here. Just really heartbreaking for Joyce.
Absolutely.
What are the common signs and symptoms for heart disease?
So the signs and symptoms do depend a lot on what type of cardiovascular disease you have. However, most common things to be worried about would be kind of chest pressure or pain with exertion. Also shortness of breath, swelling in your legs, dizziness, or passing out episodes.
If you have those symptoms, see your doctor.
Absolutely.
Is heart disease preventable? That's the big question.
So yes, heart disease can be preventable. The American Heart Association has been tracking 7 key health factors, or Life's Simple 7. These include smoking cessation, increased physical activity, eating a healthy diet, maintaining a healthy body weight, and also controlling cholesterol, controlling blood pressure, and also controlling blood glucose. Some normal levels you'll see on your screen.
And those are the numbers that you should try and stick within.
Those would be the ideal goals, absolutely.
And if you have advice to give our viewers, what would you tell them?
So advice that I would give, number one, know your numbers. If you're over the age of 30 and you do not have a doctor that you follow with annually, I implore you to find someone to follow up with so you can know your numbers and stop the progression of heart disease before it claims more lives.
Oh, great. And wonderful advice, and I know that's what Joyce wanted too. She wanted to make a difference with her story. Doctor, thanks for joining us tonight. And let's go back to the ABC27 call center. Christina.
Hi, Deborah. The phones remain busy over here, but you still have time to get your questions in. You can call 717-346-3333. The phone lines are open until 8 o'clock. And if the phone lines are busy, you can email your questions during the show to questions@abc27.com. And we're joined again now by Dr. Stephen Ettinger with another viewer question. They write, I've been on a vegan diet for over 6 years. Will this help prevent heart disease?
Well, certainly being on a vegan diet is part of a heart-healthy lifestyle, so that's wonderful. But I think we also have to bear in mind the other risk factors that we associate with heart disease. So if you're overweight or you're sedentary or you smoke, you have diabetes or your cholesterol is not under good control, having a heart-healthy diet is only a part of the equation. So I would say she should be commended for being on a vegan diet. Other things also should be a focus and attention to reduce the risk of heart disease.
Okay, not a cure-all there. Thank you. Here's our last viewer question. I've been smoking for over 40 years and recently quit when I was diagnosed with cardiomyopathy. Is there a way to reverse this condition, and will my heart rate get stronger now that I've stopped smoking?
So first, the patient needs to be commended for smoking cessation. It's very hard to stop smoking. It's wonderful not only for their heart, but their pulmonary system as well, for their lungs. Cardiomyopathy is really a weakness of the heart muscle. And so there are things that we can do for patients. So I would recommend that this patient at least reach out to her primary care provider or a cardiologist. There's medications, activities, things that she could do in addition to stay off smoking that would really help improve the strength of her heart and her fitness.
Okay, Dr. Ettinger, thank you so much for answering our questions tonight. And thank you also to our experts in the call center for answering questions that are coming in over the phone lines. Again, they will be here until 8 o'clock. Deborah, back to you.
Thanks, Christina. Joining us live is Chris Fry and his wife, Kim, to tell his story with us, and also Dr. John Boehmer. He is the director of the Heart Failure Program. Chris, you're a young guy. Something unbelievable happened last year when you were 42. Talk to us about that.
Right. The week leading up to my heart attack, I had chest pains throughout the week. And even though there was a history of heart problems in my family, again, it was a busy week at work, and I was 42 years old. I never would have thought that it was the symptoms of having a heart attack. And then on a Sunday night, it happened like my chest really tightened up. I even told my wife, I think I got to call a doctor tomorrow. I think I may be having bronchitis. I went downstairs, and when I was downstairs, it just hit me.
Kim, what was your next step? I mean, what are you thinking? You're calling 911, I take it.
Yeah, it was a very scary time. I've never seen anyone in that much pain. Like, he was literally on the floor in pain. And from knowing that his parents both had a heart attack and watching what they went through was basically, you go to the hospital, you get some stents put in where your blockages are, and in a day or two you're going home. Never did I imagine what was to come in the next 16 months.
And his case was much more complicated. Dr. Boehmer, why don't you fill us in what happened next?
Chris had a very large heart attack. In fact, he had a heart attack that was severe enough that he didn't have enough remaining heart muscle to pump blood for him, and he almost immediately required some support of his circulation. And things quickly deteriorated to the point where his organs weren't functioning, and by the time he came to us, his lungs, his kidneys, and his liver were not working well.
Pretty bad shape. So what was he put on?
So he was supported with a device called ECMO, extracorporeal membrane oxygenation. That's a device that acts as a small heart and lung machine that can take over the function of the heart and the lungs and support people until they improve.
And then after that, he had an LVAD put in place, correct?
So we needed time to get things working well before he could tolerate a bigger operation. And once we got to that point, we did transition him to a left ventricular assist device. It's a small pump that is implanted in the chest, and can take blood out of the heart muscle and pump it to the body. And it can pump a large amount of blood even though the pump itself is very small. It's a significant operation to get it. He did require a little extra support afterwards with a right heart support device that we were eventually able to take out, and he eventually was able to be discharged home.
And how was that, Chris, having an LVAD? You have to have something on your side as well.
Right, correct. Well, I was sedated for 3 months, so I wasn't even awake when I got the device. So I woke up and I had this thing attached to me. So it took a little while to get used to. I mean, all the little intricacies about it, you know, can't get it wet, got to protect it. It was easy to catch the cord if you weren't aware of it, but after some time I got used to wearing it, and it just almost became just like part of me.
And then at some point it stopped working correctly.
Correct, yeah. I'd started to keep fluid in my body, and my legs especially, because the right side of my heart was so bad, everything couldn't just handle it. So we decided to go for the donor program.
And Kim, what was going through your mind? Donor program, I mean, he was healthy months before, and now you're talking about a heart transplant.
Yeah, definitely. This was a whole bunch happening in a short period of time. And it was scary at the same time as exciting, because I saw how he lived with the LVAD and the limitations that he had with the LVAD, and knowing that he would never be able to live outside of the hospital again with just the LVAD as support. It was exciting, but it was scary because I knew it was a very big, serious operation, and you know, I was just afraid I was going to lose him.
Dr. Boehmer, as the department chair of this, talk to me about the heart transplant program.
Sure. We've been doing heart transplant at Hershey since the 1980s, and it's a very good treatment for people who are appropriate candidates for it. You do have to be put on medicine afterwards to suppress your immune system to prevent you from rejecting the heart, and monitored for complication of those medicines. But in many people it works extremely well. The problem is we don't have enough hearts available. We have the mechanical blood pumps on the shelf, and we can take one and do an operation right away, whereas we have to wait for a donor, and we have a critical shortage of donors.
And Chris had to wait.
And Chris had to wait, and he waited for months at the higher end of the list, because even though the LVAD was working, the rest of his heart couldn't contribute enough to keep him well.
And tell me about the transplant, Chris. When did you get the news, and what was the date?
The date of the transplant was November 21st. A couple days before my birthday and Thanksgiving. I didn't really believe it at first, because I'd gone through it twice where they said, we think we might have one, and turned out it just didn't match up right. But it was exciting. Again, you try and keep low key until you're actually physically in the operating room, ready for them to open you up. And it was exciting. It was very exciting then at that point in time, because that's what I had spent 4 months in the hospital for, was waiting for that moment. It was great.
And how was it for you, Kim?
Yeah, it was, like I said, the surgery was like 12 hours, and it was, you know, a lot of pins and needles, but I knew this was our chance to get our family back. If, you know, this had to be successful in order for Chris to be able to come home and spend time with myself and the kids.
And you told us, while you were talking to us earlier, that Chris, you woke up and it was your birthday.
Yeah, that was the best birthday present and Christmas gift all in one. It was truly amazing. I can't thank all the doctors and nurses and MPs and everyone at the hospital enough for all they did.
And you're involved in cardiac rehab now. How is that helping you?
It's great. I mean, I can just tell the difference in the 3 months I've been home, that I've gained so much more energy and strength just to be able to go and get ready to do the things that I want to get back to doing.
And Kim, how was it for you when they said, yes, he can go home?
Yeah, that was exciting, because there were so many times in that past, 12 months or 13 months that I thought we were going to lose him. So this was just the fact of getting our family back and knowing that he'd be able to do the things that he loved to do again. It was amazing.
Dr. Boehmer, why don't you tell us about the donor program? You said there's a need.
Well, there's a critical shortage of donors in America, and we have tens of thousands of people who could benefit from a heart transplant, but not enough hearts to go around. And the most important thing is, if you would consider donation if the circumstances should ever arise, the important thing is to have a conversation with your loved ones, because then if such an event ever occurs, they know what to do.
Okay, and we have the information who to contact if you would like more information on the donor program.
So they have the web address there, and they can inform you about it through that address.
Okay, Chris and Kim, how are your kids doing? You have twins, they're at home.
Yes.
But I'm sure they're so proud of their
they're
dad.
Happy.
Yes.
Yeah, they were very happy when I came home because they didn't really know because we weren't completely sure of the date. So it was kind of able to surprise him when we came home that night.
Yeah.
It was amazing.
They were happy to have their dad back, and we're finally starting to get back to that new normalcy.
Right.
Yeah.
Okay, great. Thanks so much, Dr. Boehmer, for being here, and Chris and Kim. Chris, you look great, and we wish you the very best.
Thank you very much.
Thank you.
Okay. And we also want to thank you, our viewers, for being here and sharing your stories and also sending in your questions. If you would like more information or would like to schedule an appointment with Penn State Heart and Vascular Institute, call 717-531-4554 or visit online at hmc.pennstatehealth.org. And to learn more about how you can get involved and make a life-changing difference for patients at the Penn State Heart and Vascular Institute, contact the Office of Development at 717-531-8497. And next Wednesday night, we will take you behind the scenes of the new Esteem Cosmetic Center. Doctors will talk about different cosmetic procedures available at the new center. R&R Rejuvenate and Renew airs at 7:30 on the 28th. We thank you for watching tonight. We received a lot of great information from the doctors. We wish you good health.